from the anatomical department. We will talk today some notes about the thoracic cavity. At the beginning, we mentioned previously that the thoracic cavity consists of several cavities inside, but we have a very important anatomical landmark, which is the sternal angle. The sternal angle, if we draw it from the manubrium sterni, from the manubrosternal joint backwards, it will be at the lower border of T4. It will divide this from here. If I draw it from here, for example, from this sternal angle backward, it will divide into two spaces. The upper space is called the superior mediastinum, and what lies below is called the inferior mediastinum. The whole inferior mediastinum the whole inferior mediastinum, by the presence of the heart, will be divided into anterior mediastinum in front, the middle mediastinum occupying the heart, and the posterior mediastinum, which lies posterior to it. طبعا the lowest border, the lowest point of the thoracic cage is at the level of L3. I gave it homework to you. I will mention it now in the lecture because of its importance. We all know that the costal margin, these are anatomical landmarks, should be known. The costal margin, and this is called the infrasternal angle, and we have the xiphoid process at the level of T9, and the lowest point of the costal margin will be at the level of L3. هذه نقاط لازم نعرفها دائما. Okay, now if we come directly to talk about the heart. We all know that the heart is a hollow muscular organ, and it is responsible for pumping the blood into the systemic circulation. In general, طبعا it is about 12 by 9 centimeter, 300 grams تقريبا الويت مالته. It consists of several borders and surfaces, and also it consists of chambers. We have 4 chambers, 2 atria and 2 ventricle, and we have a septum in between, which is called an interarterial septum above and interventricular septum below. Okay, if we come to the circulation of the blood inside of it, we all know that the right atrium, this is the right atrium, it collects the venous blood from the whole body. We have the superior vena cava and the inferior vena cava. It will collect the blood in addition طبعا to the coronary sinus, which will be mentioned a little more بعد شوية راح نذكر شنو coronary sinus. And this chamber collects the venous blood. From the right atrium, there will be passage of the blood through the right atrioventricular opening, which consists of the tricuspid valve, having 3 cusps, and the blood will be subjected to the right ventricle. In the right ventricle, it will be pumped, the blood will be pumped through the pulmonary trunk to the pulmonary arteries, to the pulmonary circulation إلى lungs, in order to be changed from carbon dioxide to oxygen, and it will return, oxygenated blood will return to the left atrium. through the 4 pulmonary veins. These are called pulmonary veins, but they are the only veins in the body that carry oxygenated blood. كنا نعرف اسم vein يحمل deoxygenated blood, لكن the pulmonary veins which open into the left atrium carries the oxygenated blood. Then from the left atrium, the blood will be pumped through the mitral valve, which is the left atrioventricular opening, into the left ventricle. The left ventricle by itself will pump the blood through the aorta, to the arch of the aorta, then the descending thoracic aorta to the systemic circulation. This is quickly مثل ما نقول circulation of the blood inside. If we want يعني by anatomy, just by looking at the heart, we can know that this is the left ventricle and this is the right ventricle, because the wall of the left ventricle is 3 times thicker than the wall of the right ventricle. Immediately, just we look at the heart رأساً by a section, نقدر نعرف من ثخن الوول بما أنه هو 3 times أثخن من ثخن الوول بال right ventricle. Immediately we can say that this is the left ventricle. Okay, if we come to talk about the blood supply of the heart, part of it is from the blood inside by diffusion, and a major part of it is from special vessels, blood vessels called the coronary arteries. The coronary arteries are a name to the blood vessels that supplies the heart. At the beginning, the heart is covered by a serous membrane, a special serous membrane, which is called the pericardium. The pericardium itself is divided into 2 layers, an outer fibrous layer and an inner serous layer. The outer fibrous layer is tough and it covers the whole heart from the outside. The serous layer itself, اللي هو نسميه serous pericardium, is divided into 2 layers. السرس نفسه يعني هن 2، واحد فايبرس واحد سرس. بعدين the serous نفسه متقسم إلى 2 layers, an outer parietal serous pericardium و inner visceral serous pericardium. outer parietal من نيجي على nerve supply ولا blood supply مالته يكون within the somatic part، يعني from the intercostal blood vessels and the nerve supply، فيكون pain sensitive. لذلك if I have a pathological condition, for example pericarditis، التهاب شغاف القلب، فالpain which is produced from it is due to the effect of the fibrous, due to the effect of the parietal layer، لأنه from the intercostal nerves and from the phrenic nerve, so it is pain sensitive. While the inner visceral serous pericardium, it lies very close to the outer layer of the heart. Even it is part of the epicardium، يعتبر جزء من الجزء الخارجي للقلب. And its nerve supply is from the autonomic nervous system, from the sympathetic and parasympathetic, so it is pain insensitive. يكون يعني ما يتأثر بالتاتش وبالتمبريتشر، اكو فرق بيناتهم يكون. The space between the parietal layer and the visceral layer is the pericardial cavity, which is a small cavity containing a few mils of a fluid called the pericardial fluid. طبعا there are some of the clinical words you should know، يعني راح تبدي تسمعها لازم تعرفها أنت كطبيب. For example, if there is fluid inside مثلا or if it is pus inside, or if it is blood inside, or if there is an inflammation، كل واحد من عندهم راح يحمل its own clinical term. Okay, this is regarding the serous membrane outside. If we come to talk about the inside of the heart with its emerging great vessels, we come to each chamber. كل chamber راح نحاول نوصفه من الخارج ومن الداخل. We have this first chamber, which is the right atrium. The right atrium have an expansion anteriorly, okay, which is called the right auricle. the right auricle. طبعا قبلها أريد أقول إنه أكو surfaces of the heart. The surface in front of you يعني immediately when I look at the heart طبعا generally speaking is as the size of a fist of a hand. كل واحد من عندنا إذا يسد القبضة مالت إيده راح يعرف حجم قلبه اللي موجود. ف the first to be seen يعني أول surface to be seen is called the sternocostal surface. هذا اللي قدام. Okay, نسميه sternocostal surface. I have another surface which is called هذا راح أسميه the diaphragmatic surface. هذا راح يقعد على diaphragm. It's called the inferior diaphragmatic surface. I have another surface which is called the posterior surface. هذا. This is the posterior surface. Okay. طبعا في borders هواية. يعني no need إنه كلش ندخل ما أريدك كلش تدوخ بالبوردرز مالته بس اعرف لي هاي السيرفيسز اللي موجودة. It's important for you to know that the sternocostal surface, this surface, consists of which chambers. يعني أنت من تباوع بالوجه يا chamber راح يكون قدامك من الهارت موجود. The sternocostal surface, 2/3 of it is the right ventricle. Okay, we will see a part of the right atrium. We will see 2/3 of the right ventricle, 1/3 of the left ventricle. هذا بالنسبة للsternocostal surface. If I come to the diaphragmatic inferior surface, راح يكون 2/3 of the left ventricle and 1/3 of the right ventricle. Okay, the posterior surface راح يتكون من الاتريا. Okay, اللي هو mainly from the left atrium and part of the right atrium. So knowing each surface with which chamber forms these surfaces is important for you to know, and you will be asked whether in practical or in theory exams. We return to the chambers. I return to the right atrium. We said that it has an expansion, small expansion called the right auricle. So I have the right atrium inside, and with its expansion is the right auricle. Okay. من أجي طبعا the openings in the right atrium is the superior vena cava above and the inferior vena cava below, and it has an opening inside, which is an opening for the coronary sinus near the inferior vena cava. هذا شنو coronary sinus؟ veins of the heart هاي اللي تشوفها الزرقاء veins of the heart ultimately will drain into the coronary sinus. coronary sinus شو؟ the atria and the ventricles, the two atria above and the two ventricles below, there is a groove in between called the atrioventricular groove. This will isolate the musculature of the atria from the ventricle, and it will lodge an important artery, اللي هو circumflex branch of the left coronary artery and also the right coronary artery, and the anastomosis in between. وقلنا الcoronary هي arteries of the heart, and also it will occupy the vein of the heart, الفين الأخير من الهارت اللي يسمى the coronary sinus. يعني تجي الفينات great cardiac vein, middle cardiac vein, هذا great cardiac vein, middle cardiac vein, and the marginal veins, and it will ultimately end at the coronary sinus. It will open, the coronary sinus will open into the right atrium. Okay, so the openings in the right atrium is the superior vena cava with no valve. superior vena cava ما بي valve. احنا نعرف انه الفينات لازم تكون بيها valves in order حتى يكون unidirectional flow of the blood inside. The inferior vena cava has a rudimentary valve. يعني can be valve in fetal life, but in adult life it carries a rudimentary valve. And the coronary sinus, it has a valve. عنده valve صغيروني يحيط به حتى اسمه Thompson's valve is called. Okay. Now, the inside of the right atrium consists of a smooth part and a rough part. A rough part is called the musculi pectinati, and the smooth part is called the sinus venorum. The line between them is called sulcus terminalis from the outside. From the inside, it is called crista terminalis. Okay, crista terminalis. وهذه بالعملي على الموديل نقدر نوضحها بعد أكثر ونعرف أهميتها، لأنه المسكولي pectinity is a rough surface of the heart and comb-like structure of muscle fibers. Even it will lower this, the blood flow inside, and sometimes a stagnation of a blood will occur, leading to the formation of small thrombi which will be dislodged sometimes during atrial fibrillation. فكلينيكلي هناك بالمختبر نحاول نوضح لكم إياها وشون مكانها وين تقدر تتعرف. على العموم هو rough part is present in the right auricle, while the smooth part is the rest of the right atrium. Okay, from the opening, the tricusp valve. This in front of you is called the tricusp valve, which consists of 3 cusps: anterior cusp, posterior cusp, and a septal cusp. The tricuspid valve is attached through cordia tendini. هذه الخيوط الصغار tendinous streaks called cordia tendini will be attached to the papillary muscle. Okay, نرجع هسه. The right ventricle also consists of a smooth part which is called the infundibulum اللي هي بداية pulmonary trunk, and a rough part which is called the trabeculae carnea. The trabeculae carnea consists of the muscles مالته, consist of bridges and ridges, and also of these papillary muscles, حلمية الشكل. It is called papillary muscles. I have in the right ventricle 3 papillary muscles: anterior papillary, which is the largest; posterior papillary, which is smaller; and I have a septal papillary muscle. Okay, كل واحد من عندهم هذا السبتال. This is the septal. Anterior, posterior, and this is the septal. كل واحد من عندهم will be attached to cordia tendini to the corresponding cusp. يعني the anterior cusp of the tricusp through cordia tendini will be attached to the anterior papillary muscle. The posterior cusp of the tricusp through its cordia tendini will be attached to the posterior papillary muscle. The septal cusp through its cordia tendini will be attached to the septal papillary muscle. Okay, these papillary muscles, when it is contracted, it will pull the cordia tendini, so it will pull and open the cusps حتى يصير directional flow of the blood from the right atrium to the right ventricle, and then it will in another action, it will force the blood, يعني the right ventricle will force the blood towards the pulmonary, towards the infundibulum, then towards the pulmonary trunk. As you can see here, this is a band. This is a muscle ridge in between the interventricular septum and to the anterior wall of the right ventricle. This is called the septo-marginal band, or called the moderator band. The moderator band. It is important in the conducting system of the heart. A wide part or large part of the right bundle branch will pass through it. So through the conducting, من راح نشرح the conducting system راح نذكرها. Okay, let us look at the pulmonary trunk. The pulmonary trunk, as you see, has also a cusp. This is called the pulmonary cusp. It consists of 3 semilunar valves. Okay? تمام. If I come now to talk about the right atrium, a right atrium also has a smooth part and also has a rough part, and the rough part is present in the extension of the left atrium, which is called the left auricle, and the smooth part has 4 openings for the pulmonary veins مثل ما ذكرنا. Then through the left atrioventricular valve, which is called the mitral valve. It consists of 2 cusps, an anterior cusp and a posterior cusp, connecting through the cordia tendini to the anterior papillary muscle and the posterior papillary muscle. هنا ما عندي septal لأن ما عندي septal cusp. يعني I have here the tricusp valve in the right side. I have here the mitral cusp on the left side. I have here anterior, posterior, septal papillary muscles, while on the left side, I have anterior and posterior papillary muscles only. Okay, if I want to talk about the conducting system of the heart, the heart beats. It beats at a rate through a minute, about 70 beats per minute. This is in an athletic or in a normal healthy individual, but it can be up to 100. Okay, يعني لحد ال100 احنا نقدر نعتبره طبيعي نبضات القلب الموجودة. How are these impulses are generated? It is generated through a special system inside the heart called the conducting system. We all know that the muscle of the heart consists of myocardial cells, and these myocardial cells are striated, multinucleated, يعني من تجي عليها having the intercalated disc. So some of these myocardial muscles are specialized to form nodes. فمن نيجي نسأل what is the conducting system, we say that يعني تعريفها راح يكون they are specialized myocardial cells that have the ability to generate impulses, consist of two nodes in the heart. One of them is called the SA node and the other is called the AV node. The SA node, which is called the sinoarterial node, has the ability to generate impulses about 70 beats per minute. And it gives the impulses to the whole arteria, which will be collectively to the AV node. And the AV node is just above. It is on the septum in between the two arteria, and it is just above the tricusp valve. It has also the ability to generate impulses about 60 beats per minute. So the pacemaker of the heart is the SA node. The AV node collectively will collect these impulses, then through the membranous part of the interventricular septum, which is called the bundle of His, and it will divide into two branches. One of them is called the left bundle branch, and the other is called the right bundle branch. It will transfer through the muscular part of the interventricular septum, and then it will end as Purkinje fibers. These are the Purkinje fibers. The Purkinje fibers will reach to the papillary muscles in order to initiate its contraction and relaxation. A large part of the right bundle branch will pass through the moderator band, or what is called the septomarginal band. Okay? طبعا this is called the apex beat. The apex of the heart. The apex of the heart, if I ask you which part of the heart forms the apex of the heart, it's the left ventricle. And it is responsible for the apex beat. And you should know by surface anatomy, it lies at the left fifth intercostal space, 3.5 inches from the mid-sternal line, just inner to the mid-clavicular line. هذه تحفظ. يعني لازم نعرف إنه the apex of the heart lies at this anatomical surface landmark from the outside. It can be seen يعني on the body of a human being while he's lying in supine position, healthy, no a lot of fat in his trunk. فالapex beat can be seen obviously. طبعا I have another anatomical surface landmark, which is the position of the nipple. Position of the nipple in male can be detected as in the fourth intercostal space, while in the female it is variable according to the size of the breasts. Okay, I return to the conducting system. كنا فهمنا إنه I have an SA node, AV node, bundle of his right bundle branch and left bundle branch. If there is any طبعا, and this is responsible for generating the impulses from the heart. The heartbeat اللي هو يتكون of lub dub, and يعني the first heart sound is called the lub, the second heart sound is called the dub. The first heart sound is formed from the closure of the atrioventricular valves من الtricuspid mitral, while the second heart sound is produced from the opening, from the closure of the pulmonary and the aortic valve. Any irregularity occurring in the conducting system will produce an irregular heartbeats, which are called arrhythmia. اوكي احنا قلنا انه how many heartbeat عندي 70 وقلنا up to 100 نقدر نعتبره normal. If it is more than normal, then this is called tachycardia. If it is less than normal, it is called bradycardia. If the heartbeats can be felt on the trunk, يعني على الثوركس نقدر نحس بخفقات القلب, it is called the palpitation. هذه أيضا بعض المصطلحات الطبية we should be known. This is regarding the conducting system. زين. Does it differ from the nerve supply to the heart? Yes. يعني إحنا كنا نعرف إنه each organ in the body has its own nerve supply. What I mentioned before as the conducting system is the generating impulses of the heart. It has no ما إلى أي علاقة بالnerve supply of the heart. The nerve supply of the heart, يعني what supplies the heart is the autonomic nervous system. It comes from plexuses. We call it the superficial cardiac plexus and the deep cardiac plexus. These plexuses are formed from the autonomic, يعني from the sympathetic and parasympathetic fibers. If I ask you, from where does the heart get its parasympathetic fiber, you must say from the vagus nerve اللي هو العصب العاشر, the cranial, the 10th cranial nerve. The vagus gives branches called responsible for the parasympathetic innervation to the heart, while the sympathetic innervation comes from the level of T5 to T9 through the sympathetic trunk and from its fibers. For fibers from the sympathetic and fibers from the parasympathetic collectively will form plexuses, ضفائر. To the heart, I have two plexuses, superficial cardiac plexus and deep cardiac plexus. The superficial cardiac plexus lies just below the aortic arch, يعني هنا نلقاها متجمعة. This is the superficial cardiac plexus. While the deep cardiac plexus, you will find it, من اسمها, you will find it deeply behind the aortic arch, just in front of the trachea. لأنه هي behind الهارت اكو موجودة the trachea هناك موجودة. يعني just below the trachea هناك, deep cardiac plexus. From these two plexuses, they will give fibers to the heart as the nerve supply of the heart. We all know that the sympathetic accelerates the heartbeat, while the parasympathetic decrease the heart beat. We all know it is pain insensitive, يعني it is not sensitive to touch or temperature. And the pain which arises from the heart, which is called the cardiac pain, is a dull pain produced by the blood vessels. The blood vessels, if it is stenoized or if it is thromboized, or if there is a problem in it, will produce due to stretch or ischemia, then there will be a cardiac dull pain carried upward by the sympathetic innervation to give the feeling of the cardiac pain. Now, طبعا the lymphatic drainage of the heart is to the nearby blood vessel, lymphatic nodes, pericardial nodes, and the bronchopulmonary lymph nodes. Now we will come to the blood supply of the heart. The blood supply of the heart from the aorta, هذا طبعا the opening of the aorta. The smooth part in front of it is this part, okay? From the aortic opening, from the three cusps of the semilunar aortic cusps, I have an anterior and I have a posterior. Well, posterior here are right and left, right and left. From the ascending aorta, يعني immediately بس تنفتح هذه راح تجي قدامك ascending aorta. From the space just behind this cusp يعني is called the aortic sinus. So from the anterior هذا شوفه, from the anterior aortic sinus, there will be a rise of the right coronary artery. While from the left, okay, from the left, from the left semilunar cusp, there will be a rising of the left coronary artery. Okay. Here it is. من نجي هنا, this is the right coronary artery and this is the left coronary artery. The right coronary artery will run into the atrioventricular groove, and if we complete شوفه كله right coronary artery, and it will give طبعا this is the right marginal artery اللي راح يكون on the right border of the heart, and the right coronary artery will continue in the groove until it makes an anastomosis with the left side. It will give an important branch which is called the posterior interventricular artery, which lies in the posterior interventricular groove with the middle cardiac vein. فراح يكون عندي posterior interventricular artery with the middle cardiac vein in the posterior interventricular groove. This is regarding the right coronary artery. If I come to the left coronary artery, immediately when it emerges, it will give me the left interventricular artery, which will run with the great cardiac vein in the anterior interventricular groove. Okay? The rest of the left coronary artery will continue as راح يسميه okay يعني صاير جو هذا. It will continue as the circumflex branch of the left coronary artery. يعني left coronary will give anterior interventricular. Will continuation of it is called the circumflex branch of the left coronary artery, ويبقى اسمه circumflex branch ويمشي بالatrioventricular groove until it anastomoses with the right coronary artery. زين. If we want to know what does it supply, a right or left coronary artery, من اسمهم حتى لا تتيه, the right coronary artery will supply the right auricle, the right atrium and the right ventricle. The left coronary artery من اسمه will supply the left atrium and the left ventricle. حلو؟ Okay. نيجي هسه على conducting system. Conducting system اللي هو very important لأنه generating the heartbeats. خذ هذه المعلومة. The whole of the conducting system, all of the conducting system is supplied by the right coronary artery, except a small part of the left bundle branch. جزء قليل من the left bundle branch supplied by the left coronary artery. أعيدها. the whole of the conducting system is supplied by the right coronary artery, except a small part of the left bundle branch, which is supplied by the left coronary artery. So for the conducting system, if I have a problem with the right coronary artery blood supply, it could lead to arrhythmias. تمام. Any defect that can occur to the coronary artery clinically, يعني whether it is stenoised or whether it is atherosclerosed, يعني الwall مالته يصير بلipid, or whether it is lodged with a thrombi, this will lead to a condition which is called either angina. If it is stenoised راح يصير is يعني an area of ischemia during exercise, and this is called angina, الذبحة الصدرية. لكن if it is thrombosed and complete blockage occur, فراح يصير necrosis at an area of the heart, this will be called the myocardial infarction, الجلطة القلبية. وهمينا بالعملي أقدر أفرق لكم بين الاثنين نوقف عليها clinically, but I want you to know that if there is a problem in the coronaries, it can be by a surgical operation replaced by other blood vessels. نجي نسوي له blood vessel يعني or replace it by a graft of a blood vessel. From where do they take these blood vessels? They will take it from the saphenous, from the lower limb, from the saphenous vein, from the great saphenous vein. They will take part of it and use it for grafting in the cardiac operations. Okay, كلكم همينا سامعين بشيء اسمه القسطرة اللي هي they pass through the femoral artery reaching upward to the blood vessels of the heart, يعني in order to see the coronaries and to sometimes inject a dye, ينطون صبغة حتى يباوعون على كل البلاد vessel of the heart. These are some clinical points that you should know. This is regarding the conducting system and the blood supply of the heart with its nerve supply. Also, I forget to mention that in the right atrium, inside of it, يعني إذا نجي inside of the right atrium، طبعا هذا هو the SA node وهذا هو the AV node. Okay, inside the right atrium, at this region, at the smooth part of it, I will have a saucer-like depression which is called fossa ovale. Embryologically, it was open, but during يعني before birth it should be closed. لازم ينسد السبتم between the two atria. لأن the right atrium is for deoxygenated blood and the left atrium is for the oxygenated blood. They should not be mixing in between the two. So the saucer-like depression is called fossa ovale, والحافة مالتها راح يسموها limbus fossa ovale. الفوسا ovale from septum primum والحافة مالتها from septum secundum. هسه بالإمبريولوجي يذكروا لكم إياها. I mentioned this important landmark because if it will remain slightly opened, I will have a clinical condition called the atrial septal defect, ASD, which is a congenital anomaly. And it will be according to the large, يعني according to the degree of the opening, يعتمد severity of this congenital anomaly. So I have a ASD اللي هو defect موجود بالفوسا أوفالي. بالضبط مقابلها باللفت أتريوم راح تسمى فوسا ليونيتا. مكانها بالضبط هي الفوسا أوفالي، عكسها باللفت أتريوم راح تسمى فوسا ليونيتا. If I have a defect in between the two ventricles, يعني بالinterventricular septum بالmuscular wall, then this is called the VSD, ventricular septal defect, which is more serious, more pathologically important. It is another congenital anomaly. فهاي راح يكون عندي ASD and VSD. If I have a defect in this branch, the right bundle branch, if I have a problem here, I will have a right bundle branch block. If I have a problem here, it will be called the left bundle branch block, and this will appear in the impulses in the ECG. يعني بالتخطيط يقدر واحد من خلال الويفز اللي موجودة can diagnose whether he has a right bundle branch block or a left bundle branch block. Some pathological terms, and we will read more about it in the future years. This was a very short and illustrating only points. I advise you to read the chapter of the heart in the textbook with opening of an image. Always open an image and try to read each chamber with its openings. يعني now we mentioned that the openings in the right atrium, I have opening superior vena cava, inferior vena cava, coronary sinus, and the tricuspid opening. The openings in the right ventricle will be the tricuspid opening and the pulmonary opening valve. The openings in the left atrium are the 4 pulmonary veins. The openings in the left ventricle is the mitral valve and the aortic valve. These are the openings. The layers of the heart are 3: outer epicardium, middle myocardium, and inner endocardium layers. These are the 3 layers of the heart. The myocardium is the bulkiest, consists of the cardiac muscle. The epicardium is to the outside. Part of it is the visceral pericardium, will be part of it. The endocardium is the inner layer of the heart, subjected into the lumen inside the heart. أريدك تعرف معلومتين كلش مهمة regarding these layers. ليش دا أنطيك إياها؟ لأنه the coronary arteries or the coronary vessels and the veins, okay, lie with its branches, lie in the epicardial, in the subepicardial region, يعني just beneath the epicardium, while the Purkinje fibers with the conducting system lies in the subendocardial layer. The rest of the muscle is the myocardial muscle. So these 3 layers are important to know, and I think histologically also we will take a view about it. I hope I said everything. We will mention a lot of points in our lab, anatomical lab, with our meeting with you. Also through the Google Meet, we will also try to receive your questions and answer them. Thank you very much.